SI6 or small intestine 6 is located in the depression, radial and proximal to the styloid process of the ulna, which forms when the hand is turned from a pronated to a supinated position. SI6 is best located with the elbow slightly flexed. Place the palpating finger on the distal portion of the styloid process of the ulna. When turning the hand from a pronated to a supinated position, so the mnemonic here is cut bread and eat soup, the palpating finger will glide into a bony cleft at the proximal aspect of the styloid process. The tendon of the extensor carpi ulnaris muscle runs along this groove. This cleft also becomes palpable when the patient rests the hand on the chest, half supinated position. Locate SI6 in this bony groove. Special features. SI6 is a she cleft point. It is an important distal point for pain and limited range of motion of the occiput and shoulder, for example, acute torticollis. And the lumbar region, for example, acute sciatica. For acute and painful impairment of motion, use strong reducing needling technique while the patient gently moves the affected region. SI6 is used to clear the head and brighten the eyes. It can treat acute neck or lumbar pain. For the eyes, this involves cases where older people begin to develop nearsightedness. Blood and qi gather at qi cleft accumulation points, making them good points to use when nourishing and tonifying are key issues. All qi cleft points are useful for invigorating or dispersing pain or obstruction along the particular channel on which they are found and are much used in acute conditions. As the qi cleft or accumulation point, SI6 eases pain and stiffness along the meridian, especially from tendons and joints which restrict movement, elbow, shoulder, neck, lower back pain, and hemiplegia. SI6 is used to prevent or cure many disorders associated with old age. Stiff, painful wrists, lower back pain, shoulder pain, poor eyesight, deafness, toxicity of the system, confusion, muddle, digestive problems. Yang in this context is understood as to support, nourish, raise. Lao means old. SI6 is for diminishing vitality, strength, vision, and hearing, bloodshot eyes, stiff or painful joints, all problems associated with old age. The Chinese name for this point, Yanglao, means to care for our parents in their old age. It nourishes the body, mind, and spirit, helps keep cynicism at bay, gives us strength to cope, helpful for a problem that the patient has been trying to cope with for years. SI6 is for poor coping mechanisms, not wanting to cope. Consider following with the wood point, SI3, so the patient can begin to move on in their life. For confusion, muddle, or a lack of maturity, accumulation points are always beneficial for chronic conditions.